The joy of healing lactational adenitis during breastfeeding. A short summary of Doris's experience treating breastfeeding mastitis. Breastfeeding is a very important and happy thing to do. However, there are some difficulties that can only be deeply appreciated after we have experienced them ourselves. Despite all the precautions we took, we encountered many difficulties while breastfeeding. And it was a grim time, with COVID-19 ravaging the world and many services in the community at a semi-stagnant state. There was a time when we were in pain and helplessness, unable to see where the hope for Doris's recovery lay, and more often than not, the two of us had to feel our way forward. Lactation mastitis in Doris occurs between 3 and 4 weeks after delivery. Doris's early mastitis treatment focused on the unobstructed flow of milk. The main treatment was to soothe the liver, clear away heat, dredge milk and reduce swelling. The massage method of lactation was to massage from the base of the breast with both hands, slowly squeezing and advancing towards the nipples, with a degree of force that Doris could tolerate. Gently tug the nipple several times while massaging to expand the milk complex in the front of the breast. This method could promote the smooth discharge of milk. 4 to 5 months after delivery, the symptoms began to worsen. The main clinical manifestations are redness, swelling, heat, and pain in the breast, local formation of lumps, and elevated temperature. According to the doctor, Doris' lactation mastitis was due to direct bacterial invasion caused by blocked milk ducts and milk stagnation. Doris' mastitis often started with a low-grade fever and mild chills. Subsequently, Doris' breasts became locally hard, with red, swollen skin, pressure, and pain. These symptoms of mastitis became progressively more pronounced and worse, with very severe inflammatory lumps in the breast and sometimes fevers reaching 39 degrees or more. This may be a chain reaction of the use of antibacterial agents. During this time, we put more effort into caring for Doris's breasts, and there are many things to keep in mind in our lives. During this time, we administered hot compresses as an adjunct to Doris' treatment to clear liver fire, activate blood stasis, and reduce swelling and disperse nodules. Sometimes when Doris' breast swelling and pain were obvious, we applied wet and hot compresses of 25% magnesium sulfate. At the same time, we massaged Doris once every 3 hours for 10 minutes along the direction from the root of the breast to the nipple and tried to express the milk or suck it out with a breast pump. We tried to prevent Doris' milk from pooling, prevent further nipple damage, and keep her nipples clean, which is the key to treating breastfeeding mastitis. Doris let our baby hold the nipple and the whole areola while breastfeeding, emptying one breast and then switching to the other side, and not letting our baby sleep with the nipple in her mouth, which would prevent our baby from sucking too hard and cracking the nipple and invading bacteria. We got into the habit of breastfeeding regularly, and when the baby did not finish sucking Doris's milk, we used a breast pump to suck out the remaining milk after breastfeeding to avoid sludge. At night, when the baby did not breastfeed for a longer period of time, Doris got up regularly to express milk to eliminate the swelling, keeping the breasts clean and comfortable. Before breastfeeding, clean the breast carefully, especially the nipple and areola areas. Then applied hot compresses to the breast with a towel to help the milk ducts flow smoothly. Change the underwear frequently to avoid contaminating the nipples with unclean underwear, which could lead to breast infections. And do not wear bras with steel supports, which could squeeze the breast and cause local breast milk stagnation. We sometimes found a slight nipple inversion in Doris' breasts, and we washed the nipples with 3% boric acid water before and after Doris nursed them. Sometimes when we find a broken or ruptured nipple, we suspend breastfeeding and use a breast pump to suck out the milk to feed the baby to keep the breast clean and prevent bacterial infection. Avoid squeezing the breasts and wear loose clothing as much as possible. If the breasts were swollen and painful, or if there were lumps on the breasts, use heavier strokes when we massaged them regularly. When we found out that Doris had mastitis, we started to worry about whether Doris could still breastfeed our baby. Would there be any negative consequences if we continue to breastfeed our baby? According to the guidance of information, after having mastitis, it was important to keep breastfeeding even if it was inflamed. Because stopping breastfeeding not only interfered with the baby's feeding, it would also increase the chance of milk stagnation. Therefore, when Doris felt painful, swollen breasts and even localized redness of the skin, we still diligently breastfed our baby and tried to suck out the milk from her breast. Generally, mastitis is a problem on one side of the breast. The other side of the breast is still healthy. So Doris fed with the side that was not inflamed and had no problems. This means that when there is a localized problem with the breast, we stop breastfeeding on the affected breast and drain the milk using the usual milking technique or a breast pump to facilitate the flow of milk. At the same time, the baby was still allowed to breastfeed from the other healthy breast. In addition, we made some measures in Doris' diet, such as not eating stimulating foods, such as onion, ginger, and garlic. During the pus-forming stage of mastitis, Doris ate less or no meat and fish soup that had a milk-producing effect to avoid aggravating the condition. Wheat flour, corn, soy and some other grains as well as milk and its products were good for Doris' breast health and calcium supplementation, and Doris tried to eat as much of these foods as possible. During this period, Doris also developed the habit of eating foods such as mushrooms, walnuts, silver fungus, and black fungus. This is because these foods are natural bioresponse modifiers that boost the body's immune system and strengthen the body's resistance. Grapes, kiwis, lemons, strawberries, citrus, figs and other fruits that contain a lot of antioxidants all contain multiple vitamins that have the role or function of preventing breast cancer. A reasonable mix of vegetables and staple foods is good for health, such as tomatoes, carrots, cauliflower, pumpkin, asparagus, cucumber, loofah, radish, and various green leafy vegetables. There are also nuts, which are the nuts and seeds of foods that contain high amounts of antioxidants. Our knowledge of all of these was further enhanced by practice. In addition, when we looked at information on the efficacy of herbal remedies for mastitis, we found that dandelion tea was particularly effective in preventing and treating many breast diseases. So, Doris drank a cup of tea with dandelion every day, and she feels very good. When making tea with dandelion, we also added some roses, red jujubes, lungans, etc., which could relieve the coldness of dandelion. Every day before going to bed, Daniel used boiled mugwort water to soak Doris's feet, through the foot soak to circulate the blood in Doris's body. Especially in winter, the effect is more obvious. Mugwort foot soak helped to remove dampness and avoid the accumulation of large amounts of dampness in the body and the corresponding adverse consequences to the body. In addition, there is a local recipe for mastitis using boiled eggs with mugwort, which we have also tried.